Good morning to all. So today we will have the past 4-year question discussion. First, all the best to all of you who are preparing. So what we are going to do in this session is this. We are taking the last 4 years questions, out of which the first 2 years questions we are going to really dissect and see into it. And then the next set of questions, that is the 2020 and 2021 questions, we are going to see it how majority of the questions have come from 2023, and only those that require discussion we will dive deep into it. So this is the plan. We would do this for around 45 minutes, and after this we would move on to image-based question discussions and few changes which are supposed to come in July in the IPC Act, which has changed into BNS. Okay, so with that we will start the session. So I have put the year also for your reference. The autopsy technique, where body organs are removed en masse. So they have given the word en masse, which means the whole organ as a mass it's being removed, right? It's Letouilly's technique. Okay? So let's try what is Rokitansky, Virchow's and Gon's technique. Okay, Gon's is en bloc. We have already studied this, that when Gon's in tuberculosis, we talk about focus in the subpleural and in the lymph node region. So similarly, when we are removing it as a block, one set at a time, like the thoracic cavity is removed at one set, abdominal cavity is removed as one set, that is called as en bloc. Okay, that's called as en bloc. Because is the most common one that we practice, which is we remove one organ at a time. Okay, one organ at a time, like we remove liver separately, kidney separately, spleen separately, stomach separately. So that's Virchow's technique. Rokitansky is in situ dissection. Rokitansky is in situ dissection. Now, Rokitansky is suggested for infectious diseases, and when we say Letouilly's and Virchow's, where we are removing all in one and one set of organs together, these are preferred for cancers. So we know how the metastasis happens. These are also preferred for infection. But Rokitansky is set for infections. Okay. So again, another question, 45-year-old HIV positive patient with tuberculosis died suddenly, and the body was brought for postmortem examination. The dissection technique that will be utilized is Rokitansky technique, right? Rokitansky techniques we will be using. All right. A worker working in hot weather condition in a field collapsed with altered consciousness, and the temperature of the patient was 106 degree Fahrenheit, which is nothing but 41 degree Celsius, right? So when we say about the core body temperatures to 41 degrees Celsius, we are talking about heat stroke. Okay, so what happens with heat stroke? The sweating stop. All our thermoregulatory centers shut down and the sweating start, right? So that is the answer. Okay, so when the sweating stops, that's when we are seeing it in heat stroke. Okay, okay. Let's see the next one. At autopsy, the temperature of the dead body was raised to 39 degrees Celsius, which means the body temperature has raised above normal. Postmortem, at autopsy. See, they have not used the word postmortem, but they have said at autopsy, which means they are talking about postmortem caloricity. Okay, now postmortem caloricity is seen particularly in conditions with S, right? So S is seizure, S is sepsis, except for septicemic shock. S is heat stroke, and S is strychnus nux vomica, right? Strychnus nux vomica, right? So all of these are known to produce increase in temperature for just few hours after the death of the person. Now see, what happens in this is when the patient has a seizure, the body metabolic rate increases, right? So the temperature increases. The same goes with strychnus nux vomica, which is going to mimic similar to a tetanus. Then you have sepsis. Except in septicemic shock, the body temperature is going to be high. And of course, heat stroke. We just saw that in heat stroke, the core body temperature is already high. Okay, let's look into this one. A 45-year-old male has taken herbal medicine. He was conscious at presentation with contraction of all limb muscles and arcing towards the back, which means they are talking like a, yes, tetany-like position. The tetany-like position is seen with Strychnus nux vomica. It is a spinal poison. It's a spinal poison. Okay. So you guys try it. Ricinus is what type of poison? Ricinus nux. Ricinus communis. What type of poison is ricinus? See, because what comes as an option in the previous years generally tends to come as the answer in the next year, right? So ricinus is a plant poison, which is very good. Which group can we put it in? It's a stimulant, depressant, irritant. Irritant, very good. It is a irritant. What about nerium? Nerium is cardiac, very good. Abrus, Abrus precatorius. Abrus precatorius. Try. When you early in the morning you try, you tend to be awake more. So Abrus precatorius. Abrus, where we make sui, the needle which is used, exactly, irritant again. See, Abrus is the one, remember Abrus with sui? We made a, yes, cattle poison. So it's an irritant, okay? Yes, next, Datura. Datura is CNS. Datura is CNS. The other question that has come previously, before last 4 years, is nicotine. Nicotine is what type of poison? Nicotine. Very good. Cardiac poison. Nicotine is a cardiac poison. So I'll be sharing this document also with you. Please do revise through it once. So I've compiled it as much as possible so that we are able to revise it in one go at one time. Yeah. So you have nervous system poisons. Cerebral stimulants are there. Stimulants includes the coffee that we drink and amphetamine. And then you have depressants. Depressants, alcohol, anything that causes a person to go into a sleep-like state, right? Alcohol, anesthesia, barbiturates, your opioids, all of these are going to be your depressants. Then comes your dereliant. With dereliant, try to remember these. Like, yes, with Datura, many of you told this already, roadside poison, stupefying agent, right? It is a stupefying agent, which means the person is just going to forget everything, but at the same time, he's also going to lose some amount of his mobility, right? So he's just going to sit there, having forgotten what has happened, and he's been robbed at that same time. Cannabis is known to cause run amok. Okay. And this run amok is seen in chronic cannabis use. Okay. Datura, you have cocaine bugs. Datura, you have stupefying agent. Cocaine, you have cocaine bugs. And last, Atropa belladonna. Atropa belladonna is known to cause very good hallucination. Okay. Okay. Then we have spinal poison. Spinal poison, nux vomica has already been asked. The other spinal poison is gelsemium. Okay. So the other spinal poison is gelsemium. Nux vomica is important. See, it affects the anterior horn cells. And it causes seizure-like features. Okay. Okay. Next is peripheral nerve poisons. Curare, organophosphate. See, conium, not cocaine, it's conium. Okay, so all your organophosphates, agricultural poison, conium and curare. Curare, don't even guess about it. It's peripheral nerve poisons. Heart, we have seen all oleanders, which includes our Cerbera thivacea, our Nerium odorum. All of these are coming into our oleander group. You have quinines and aconite and tobacco. right? Tobacco again is important. It's been already asked. Okay. Now, the nicotine in tobacco, apart from affecting the heart, it also affects the vessels. Okay. It also affects your vessels. Okay. And all your drugs which you give for your hypertension and everything, they have their effects on the vessels also, right? Then last, respiratory. Respiratory, we have carbon monoxide, carbon dioxide, hydrogen sulfide, which is a severe gas. And this hydrogen sulfide is also used as a suicide, right? It's used as a detergent suicide. Then methane and of course your cyanide. Methane and cyanide. Okay, let's see the next set of questions. Okay, the child here presents with fever, confusion, photophobia and dryness of mouth. One of the clue that can easily point us towards is, yes, of course, the increase in temperature. And the other thing is dryness of mouth, right? Now, see, organophosphate poisoning, patient presents with increased sweating and everything. You're going to give atropine as the treatment, which causes dryness and everything. And datura, in datura, the active principle is nothing but your atropine, right? One of your active principle is nothing but your datura contains atropine. Now, once you see atropine, the antidote for atropine is physostigmine, right? Antidote becomes physostigmine. This becomes the antidote. Yes. Okay. So that's why we say in exams, don't panic. Many a times the clues are hidden here and there. See, your yellow oleander and all is cardiac poisons. So they would have given some feature that's related to, like, heart and everything. They have not given anything related to heart. They have mainly spoken about the dryness and fever and confusion. All are classically seen with datura. Also remember, like we studied with datura, that it is a stupefying agent. The patient has retrograde and anterograde amnesia, right? So here you have a poison which causes confusion, dryness and fever, means that's datura we are talking about. Okay. The similar thing, if they have given you hypertension, if they have given you the word hypertension and high fever, then you can think about cocaine. Okay, hypertension is more classical with cocaine, but when they have given you fever and dryness of mouth, go with datura. Okay. Yes, OPC poisoning, treatment done with atropine and pralidoxin. The patient becomes hyperthermic, hyperthermia, right? Again, you see it in atropine, right? Okay, ma'am, for oleander poison, is there any specific antidote? There is no specific antidote for oleander poison, but what we do is there is something called as the digoxin immune fab, right? You have something called as the digibind. For yellow oleander, you use something called as the digibind, which is nothing but the digoxin immune fab. Okay. Yes. So we use this to counteract the symptoms. So it's an antidote. Okay. It's a physiological antidote which is serologically developed. So it's a serological antidote also. Yeah. Okay. Now next, OPC poison, patient presents with atropine. Atropine toxicity is what we are seeing. The patient has become hyperthermic, right? Hyperthermic. Okay. Let's see some of the important ones alone. Okay, and here I have tried to put in our heavy metals also, so that in one place we have every revision to go with. Okay, atropine, you have physostigmine. With atropine, what is the antidote that we use is the physostigmine. Organophosphate compound. Organophosphate means we can use atropine and pralidoxin. Organocarbamates, if they have given, preferable is atropine only. Okay. Similarly, in ethylene glycol, your fomepizole becomes the first one. Whereas in methanol, the ethanol becomes the first drug of choice. Okay. Ethanol is the alcohol that is consumed. Okay, so for methanol poisoning, you will use ethanol. For ethanol poisoning, you will not use methanol. Okay. Opioids, we all know naloxone, nalmefene, and nalorphine are used. When we talk about benzodiazepines, we are using flumazenil, right? When we are talking about benzodiazepines, we are using flumazenil. Paracetamol, N-acetylcysteine. So when they give you N-acetylcysteine, there's one drug that you have to take about is paracetamol. Okay, and then cyanide. Cyanide, when we talk about, okay, sodium nitrate, sodium thiosulfate, these two are used together. Now, in the previous, just now the one that got over, right, INICET, they have also given the option of amyl nitrate. Okay. Now, sodium nitrate is given in the blood, whereas amyl nitrate is given as an inhalation. Okay, so what they say, the teachers is break amyl nitrate vials, pour it in a kerchief and keep it in the nose of a person. Again, like not a very effective treatment, because if the person doesn't have that much circulation for an IV line to be set in and everything, the probability of survival is lesser. But that's one of the alternative that's given. Okay, so when they give you sodium nitrate or amyl nitrate, think that it can be used for cyanide poisoning. Both of these are going to be helpful to produce methemoglobin. They both produce methemoglobin. This methemoglobin will act with cyanide. You get cyan methemoglobin, and then that cyan methemoglobin will be taken out by your sodium thiosulfate. Okay, your cyan methemoglobin will be taken out by sodium thiosulfate. Okay. Then your nitrates, nitrobenzenes, methemoglobinemia, all of these you will use methylene blue. Now these are the cases where the patient already comes blue in color because of the methemoglobinemia, and apart from it, now you're going to give methylene blue also. Okay, so we call it as the blue patient. So these are the nitrobenzene methemoglobinemia patients. Insulin, easy glucose, whenever the patient has any kind of asphyxiant gases like your carbon monoxide or hydrogen sulfide, hyperbaric oxygen becomes important. Okay, because one is going to form sulf hemoglobin, the other one is going to form carboxy hemoglobin. You just want to remove them and give oxygen into your blood. Then we have heavy metals. Heavy metals have been asked before. BAL, British anti-lubicide, can be used for malt mainly. Okay, so we studied a bigger one, malt BCG, but at least remember malt in it. Mercury, arsenic and antimony, lead. Okay, so mercury, arsenic and antimony, and lead. Okay, remember that. Dimercaprol is nothing but the oral form of it. This is the oral form of your dimercaprol succinic acid is the oral form of dimercaprol. Then you have calcium disodium EDTA. Calcium disodium EDTA is specifically used in lead. And when we saw about D-penicillamine, it is used in copper poisoning along with Wilson's disease. And desferoxamine, we are going to use it in iron poisoning. Okay. Digitalis, digibind. This is going to be used in all your oleanders also. Okay. Isoniazid, you have pyridoxine, and methotrexate, folinic acid, right? Methotrexate, you have folinic acid. The first few ones have been asked repeatedly, like atropine, OPC poisoning, they give a case history and ask methanol, like, patient who has consumed alcohol illegally, presents with blindness, right? Illegal methanol. When we are seeing methanol, we see about illegal, and along with it, if he presents with blindness, history comes, think about ethanol. Okay. Okay, let's see the next part. Which of the following is an appropriate treatment for a case of aspirin overdose? Okay, who has consumed more than 100 tablets of it. N-acetylcysteine we have seen for paracetamol. Okay. Now, activated charcoal is very good at taking it if the poison has not been absorbed. Right, your gastric lavage and activated charcoal. But again, if the person has consumed and it has been absorbed, we are talking about salicylates over here. The ideal treatment is going for diuresis with sodium bicarbonate. Okay, diuresis with sodium bicarbonate. Okay, so this becomes the treatment. Okay, so let's see some other antidotes, and serological antidotes include your anti-snake venom, which we give it in snake envenomation. We have digitalis immune fab, which is nothing but your digibind, and then you can do dialysis or you can do post alkaline diuresis, right? Okay, now hemodialysis, remember your volcanic blast. Again, I will share this document with you, go through it, it's just for your remembrance. Okay, and for hemoperfusion, we studied D for digitalis, C for carbamazepine, B for barbiturates, P for paraquat poisoning, and M for methotrexate. Okay, you can make mnemonics in your own way, but remember these the common areas that they ask is this antidotes and how you will remove and absorb poison. So these 2 pages, please do revise through it when you go through. Okay. Dialysis, when we are doing hemodialysis, HD, remember about volcanic blast. B for valproate, B for barbiturates, borates, bromides, everything. L for lithium, A for alcohol, S for salicylates, and your Strychnus nux vomica, spinal poison, and then theophylline we have. Hemofiltration, AM. Okay. I remember it like, we put on the filters in the morning, AM, right? So aminoglycosides and your methotrexate becomes for hemofiltration. Okay. Easier way to remember which one goes for acidification and which one goes for alkalinization. Alkalinization is done for anything that ends with ates, that's your acids, right? Salicylates, barbiturates, methotrexate, formate. So anything that has an ate. Okay, so see, they have given us aspirin, which is nothing but your salicylates, which we are talking about. All of this will go in for alkalinizations. Okay, and then anything with mines, ines, ons, right? All of this will go for acidification of urine. Okay, okay. Let's see the next part. A farmer was sleeping on the floor, was awakened by a sting in his leg. He saw something moving. Later, he got drowsy and was taken to the emergency department. The car was pain around the side. Profuse bleeding was there. See, this becomes the clue. Bleeding was there. Which of the following is a likely organism? Which of the following is a likely organism? Okay, so we have viper, cobra, brass bite, and scorpion that they have given. Okay. So let's understand snakes. So when we say about snake, I always say, remember the big 4. Our big 4 are our common cobra, common crate, Russell's viper, and saw-scaled viper. Okay, so for this, all these big 4s only, you will be using anti-snake venom. The rest of it in India, it will not be effective. One thing is this. The other thing we also remember is the cobra and crate are neurotoxic, right? And viper and saw-scaled and Russell's viper are vasculotoxic, right? Now, when we say vipers, V for vasculotoxic, they are going to produce, patient will have bleeding from all the sides, the coagulation profile is altered, clotting time is increased. Any of these include your vasculotoxic. Now, in your neurotoxic, you have presynaptic and postsynaptic, right? Cobra, CR. Cobra, right? CR, right? And your crate, KR. Now, crate is a presynaptic agent. Crate acts in the presynaptic area. Okay, whereas your cobra acts in the postsynaptic area. Okay, so what happens when you are having cobra? You can use atropine followed by neostigmine. Whereas in crate, this will not be effective. Okay, so AN is mainly used for cobra. AN is mainly used for your cobra. Cobra, CO, post. Crate, PR, pre. Okay, cobra, CO, postsynaptic, and crate is your presynaptic working agent. Okay, so these have all been the MCQs that they have asked from this region. See, in one of the MCQs previously, that's again in Infanticide, they have asked it like that. They have asked pit viper. In pit viper, you can give anti-snake venom, and they have also given atropine neostigmine can be given in crate. So among these two statements, the false statement, both are actually false. But if you have to pick one, then in pit viper, anti-snake venom can be given is a much more false statement. Okay, so sometimes they will give you some very close ones, so don't fall for it. Only in these big fours, anti-snake venoms can be given. Your atropine neostigmine treatment is mainly for cobra. Mainly for cobra. Okay. But again, very rarely it's useful in crate. Okay. So mainly it's for cobra only. So stick to cobra only. Occasionally, when they try to confuse you, take the big four as the first clue. Okay. All right. Then one more question that they've asked previously is the right therapy. R is for your reassure the patient. I is for the immobilize the patient. Reassure, immobilize. Go to hospital. And finally, tell the doctor and get the treatment done. Okay. So this is the right campaign that's going on. So they've asked once questions from this also. Okay, let's look into the next one. Chronic alcoholic presence in a confused state with loss of muscle coordination with abnormal eye movements and double visions. The above mentioned condition is seen in Goa, right? Goa. Global confusion. Ataxia. And ophthalmoplegia. Global confusion, ataxia, and ophthalmoplegia. Okay, so Goa. Now, this is seen in Wernicke's encephalopathy. So let's understand a bit about Wernicke's encephalopathy and Korsakoff psychosis, because again, Korsakoff psychosis has been asked just now in the Infanticide exam. See, important to know in right person. Okay, I'll tell you that, doctor. Yeah. Okay, so what happens is this. You have Wernicke's encephalopathy. Again, in alcoholics, thiamine deficiency, it is seen. Now, patients with Wernicke's encephalopathy, 10 to 20% of them have higher chances of mortality. Okay, so 10 to 20% of them go for mortality. 80% of them go for state of Korsakoff psychosis. Okay, so Korsakoff psychosis follows generally a Wernicke's encephalopathy. Generally, that's why we call it as in Wernicke's Korsakoff's psychosis. So in Korsakoff psychosis, what happens is the feature becomes amnesia. In Korsakoff psychosis, along with your Wernicke encephalopathy, the patient's presents with amnesia. Now, what type of amnesia? He's not able to form new memories. So he's going to have anterograde amnesia predominantly. Now, this amnesia, just because I don't remember whether I had a coffee or not. So what do? I try to fill the gap in my memory by thinking that I didn't have coffee and I make another coffee, right? Or I may think I've already had a coffee and I might not take a coffee also. But there is a gap in memory and the person fills the gap in the memory. That is called as confabulation. That is called as confabulation. Now, when amnesia and confabulation has come in, we are talking about Korsakoff psychosis, where apart from this, the patient can also have neuritis symptoms, hallucination, psychosis, right? He can have hallucinations and other things. But this amnesia and confabulation, filling the gap in the memory, are classical of Korsakoff psychosis. Okay, are classical of Korsakoff psychosis. In Korsakoff psychosis, the rate of recovery is around 20 to 21%. That's all. Okay. This is about Wernicke's encephalopathy and Korsakoff psychosis. Delirium tremens is seen with alcohol withdrawal. Okay, not during consumption of alcohol, but during the withdrawal stage it is seen, and the patient can have a depression to suicidal tendency and other features associated with it. Run amok is seen in cannabis poison. Okay, run amok, where there is a violent spur to like go and do insane behaviors like kill a person or commit a suicide and all these things. Okay, so 314 IPC, the abortion sections have been asked. Again, not a very nice question, very completely a memory-based question. Since you guys are writing it in the month of June and still we have not got BNS, let's just look into it. 312 is for causing miscarriage, okay? Causing miscarriage with consent. So 314 is without consent of the mother, okay? When we say 315, there is a death of mother. When we say 316, okay, so 312, 313 is without consent of mother, 314 is death of the mother happens. See, in 315 and 316, there is a death of fetus, death of the unborn child, right? Now, in 315, okay, the intention is to kill the child. In 316, the intention becomes to kill the mother. So 312 to 316 deals with it. Again, a completely recall based question, not a very encouraged questions, but unfortunately sometimes these kinds of questions do come in. Okay. Ma'am, IPC for fake death certificate. All false certificate will come under false certificate. Will come under 197 IPC. Okay. And the punishment is up to 7 years. Okay, up to 7 years. Like your 317 and 318 talks about abandoning a child and causing, disposal of a child without proper information. A child has died, they are disposing the body without proper information. Okay, proper information. Okay, let's look into the last question. A 10-year-old male child has presented to the casualty with difficulty in walking and pain in perineal region, okay, which we are talking about is sexual offense. Swabs were taken, picric acid shows needle-shaped crystals, okay. Picric acid shows needle-shaped crystals. We are talking about picrate crystals, right? And the name of the above test is Barber's test. Okay, so we studied mainly 3 crystals in photographs and 1 more crystal is fluorescent test. Okay, so let's look into those crystals alone. These 2 are you're seen in blood. Okay, and one is hemochromogen. Chromo means color, right? Chromo means color. So we are talking about pink feathery crystal, right? Pink feathery crystals, and this test is known as Takayama. Whereas the second one which you're seeing is a rhomboid crystal, right? Now, this is seen in Hemin test. Okay, this is seen in Hemin test, and this test is called as the Teachman test. Okay, so how I remember? I-T-E-I, Hemin, I. Okay, so with that we remember it. And rhomboid is also, if you see this image, it's almost like eye-shaped, right? Eye-shaped crystals you get in over here. Okay, when we see about seminal stains, we have Barber's test, or it's called as the picrate crystals. Yellow-shaped needles are seen. Yellow-shaped needles are seen. Whereas other crystals which we get is in seminal stains with chlorine peroxide, right? Chlorine peroxide will produce a yellow color stain. Again, I'll share this document, revise through it. Other important points that they have asked is these are vaginal epithelial cells. What will you use to see it? You will use Lugol's iodine. Vaginal epithelial cells, you're going to use Lugol's iodine. Salivary stain, you use amylase, okay? And to detect whether the person is it's a human blood or a not human blood, you use precipitin test. Okay, all your color tests are your presumptive test for whether it's blood or not. Whereas all your crystals are confirmatory test. Okay, all your crystals are confirmatory tests. Okay. Okay, apart from it, I just want you to know about deception detection test. We have revised through it. Just once a quick revision. You have polygraphy, brain mapping, and narco analysis. Okay, polygraphy, brain mapping, and narco analysis. In polygraphy lie detection, the one that they use all the physiological response, heart rate, blood pressure, respiratory rate, sweating, and all these things are monitored. Brain mapping, murmur is the word you want to remember. And in narco analysis, sleep-like state, truth serum, thiopentone sodium. Okay, thiopentone sodium. Okay. Ma'am, human hair identification test any ma'am. Okay, so to know whether it's a human hair or not a human hair, we do mainly in the microscopic. In microscopy, we see it and we look for a factor called as in hair. We look for a factor called as the medullary index. Okay, we look for medullary index. Okay, let's see the next set of questions. Okay, NEET 2022. The range of shotgun injury. The range of shotgun injury. You are able to see blackening. This is what you are seeing is blackening. This is seen in close contact, right? It's seen in close shots. Okay. Okay. So let's see it. Whenever you have the firearm, always remember your bullet which comes in, which is going to carry your, it's going to produce a hole in the skin, and along with it, it can also produce a abrasion collar and grease collar. Okay, then you have your gunpowders over here, and these gunpowders, if they are fully burnt, the gunpowder has become an ash, it can produce blackening. And if they are partially burnt or unburnt, they can produce tattooing or peppering. Okay. Now, this blackening, smoke will travel very close, very near range only. Okay. So here you have a close. Okay. But whereas if you have got a contact, what would have happened is that the size of the injury would have been bigger because the air is going to go inside and blast off. Okay. So let's see this. This is tattooing. And can you tell what has produced this? What is the second injury? Yeah, very good question. Yes. So that's why I wanted to see you see this. Yes. Yes. Very good. Yes. Yes, doctor. This is why we call this is a shotgun injury. Shots. Okay. Why I can't say why is this a bullet and not a pellet? When we say pellet, the injury is more of a rat hole it becomes, or it is pretty big. Okay, because you're going to have multiple small shots which are coming out, right? You will not get a fully fledged injury like this. So this is generally produced by a 0.9 centimeter or a 9 mm cartridge gun. Okay, so this is a gun. I hope I have cleared it. Okay. Yeah, good. Good. Okay, let's see the next question. Injury best described by. Okay, so they have got it in the palm. It's not in the wrist region, right? So this is a defense wound. See, there is bleeding, right? So it's not a postmortem injury. Hesitation cuts are seen when generally in the wrist region. So, and they are generally multiple. So again, this is not the thing. And the last thing that we would see is it's a defense wound. It's not an incise looking lacerations because incise looking lacerations are generally seen over bony prominences, bony region. So not this. So this is a hesitation cut. Now defense wound can be active or passive. This image, one is what? Active or passive? One is active or passive? Very good. One is active, where the person is trying to actively catch the weapon. Passive is when they are trying to just protect themselves. Okay, so this is passive. This is passive. Okay. Okay, let's go ahead. Yeah, another area that they like to ask question is from the metal poisons. Okay, so other area that they like to ask question is from the heavy metal poison. Increased level of lead. They have given lead already as a clue. Okay. Now all they are asking is which enzyme is getting affected. So this question overlaps with biochemistry also, but we have already seen there are two main enzymes which increases, right? Delta aminolevulinic acid and porphyrin. Okay. Okay, ma'am, can nightstick fracture be considered as a defense wound? So, okay, any type of fracture that happens, any type of injury that happens, we call it defense when the person is trying to protect themselves, their vital organs with non-vital part of the body. The limbs are generally considered non-vital, right? So when they use non-vital part to protect their vital organs, we call it defense wound. You might get a abrasion, contusion, laceration, incise wound. We indeed have seen cases where people get chop wound, you know. So the guy tries to chop, the girl holds her hands like this, they get chopped in their hand. So it can be any type of injury that they can get. Okay. So coming back to lead, increased level of delta aminolevulinic acid and porphyrin is seen in lead poisoning. Okay. All right. Now, this again, I would revise through with you quickly because again, a lot of questions comes from metal poisons. Okay, so let's revise through it quickly. Raindrop pigmentation, hyperkeratosis. Okay, so all these things are seen with arsenic. Skin, if they give, and nails including, okay, so they give a golden hair and nail, they give Aldrich Muir lines on nail, black foot disease, raindrop pigmentation, think about arsenic. Now, along with it, let me make it very clear. If they give alopecia, where there is loss of hair, right? Then when they give alopecia, think about thallium. Okay, think about thallium. Along with this, if they give alopecia, think about thallium. Okay. Okay. Again, other clues that they give is it retards putrefaction and it can get absorbed from the soil post-humerus also. But again, remember you are going to get Aldrich Muir lines in your question, raindrop pigmentation. So instead of the word raindrop, they can use current hyperkeratosis and other things also. Now, if the patient is having a chronic poisoning, he will present with the cholera-like symptoms. So the word cholera becomes important. Mercury, don't forget your Danbury workers. Danbury, right? Danbury, tremors, Danbury, Hatters, shake, right? Hatters, shake, Danbury, tremors. This is also known as the high drag reason, chronic poisoning. Erythism is neuropsychotic, which means, see, erythism means don't think about skin condition. We are talking about mercury poisoning where the patient can have insomnia, depression, right? All of this comes under erythism. Then you have minimata disease. Okay, minimata disease, and finally acrodynia. Acrodynia is also called as the pink disease. Okay, so if they use Danbury, minimata, Methyl mercury is the most toxic form. Okay. All right. Lead. I'll take a question at the end of this thing. Yeah. Lead, you get punctate basophilic stripling in RBCs. See, remember, it's going to affect your heme. So you get your Bartonian line, you get your lead lines in the X-ray. The patient gets encephalopathy. All these lines, Caboot's ring. All of this is seen in lead poisoning. And last is copper. Copper is a simple, easy person. He presents with vomiting, right? Particularly blue color vomit. And if it's chronic, he's going to affect our hepatolenticular system. Okay, which means your liver and your basal ganglion is affected. Liver and the basal ganglion is affected. Okay. Questions: does alopecia not seen in arsenic poisoning? It's classical of thallium. That's the thing. See, the symptoms will overlap, but the thing is, it's classical of one particular poison. That's all. Okay. Like we say, hyperthermia, hypertension, all of these are given, and you get a case of drug abuser, means go for cocaine. Whereas if they don't give the word drug abuser, then you go for your other poison. So it's kind of what is seen classically in which. Okay. Then at autopsy, ligature mark is horizontal. What are you talking about? We are talking about ligature strangulation. Right? Okay, so let's revise through it. Given how to choose. Alopecia is given means go for thallium, doctor. Yes. Okay, let's revise through it fast. This is smothering. Putting cloth inside the mouth is gagging. Okay, this is smothering. Putting clothes inside the mouth is gagging. This is manual strangulation. If you use the hand, this is called as manual strangulation or throttling. Okay, whereas if a rope is used and tied and crossed from the back, that is ligature strangulation. Okay, that is ligature strangulation. Tends to be more horizontal. Okay, tends to be more horizontal. Now, in your ligature strangulation, if the person is like, the thread or the ligature material from the back is slowly twisted. If the ligature material is slowly twisted, it's called as garroting or Spanish windlash. If someone uses a rod to compress like this, that's called as Badstola. Then you have your mugging. In mugging, you have two types. This is mugging, right? Now, when the elbow comes in the center, it's called as the blood choke because both your blood vessels on the sides are compressed. Okay. Whereas when the forearm comes in the center, you call it as air choke because the windpipe is obstructed over here. Okay. So these are the strangulations that we see through. I have again given a small note regarding the same. Read about it. Burking is person sitting on the chest and then closing the person's mouth. That is smothering plus traumatic asphyxia. Smothering plus traumatic asphyxia. Okay, so just revise through this today. Do it today. Just revise through it. Okay. Then a surgeon under the influence of alcohol injures a person. This is a criminal. See, when we say criminal, there is gross. Okay, even you and I will not agree with it. There is no debate at all. Could be, maybe, nah, no, could be, no, maybe, right? So when we are talking about gross medical negligence, it comes under criminal negligence. Okay, there are few cases in Supreme Court which has come as gross negligence, like when the patient is having a postmortem hemorrhage, giving instructions or doing telemedicine, like not telling the patient go to the hospital or not, coming and seeing the patient, just giving postpartum hemorrhage. And another thing that they've taken is let's take a case of homeopathy doctor treating a patient with appendicitis or like operating for appendicitis. All of these have been considered as gross negligence. Okay, gross negligence. Okay, the defenses against negligence. Let's just look into the ones that they have come in for. Okay, so I think I'll be extending it for just another 15-20 minutes. So vicarious responsibility or while respondent superior, captain of the ship, senior is responsible. Now the senior is responsible will apply only in civil cases, not in civil cases, criminal cases, cannot be used in criminal cases. Okay. Then you have dereliction, right? I did not do the error at all. Damage, you can say always a therapeutic misadventure or medical misadventure. Voluntary non-fit injury. Voluntary means they have given the consent. I have told them everything. Okay, and I did for the benefit of the patient. See, even if you have told everything, you should have done it for the benefit of the patient. That becomes important. Then you have direct causation. In direct causation, these words, novus actus intervenus. It means an intervening act saves you, right? The classical example is ambulance. A doctor is there, MI patient comes, doctor did not give the stat dose, sends the patient in an ambulance to a higher center, ambulance meets with an accident. Though the patient did not sustain any injury, if he has died because of the heart attack, there is an intervening act, and that intervening act could have precipitated his damage, right? So that is novus actus intervenus. Now, apart from it, I would like you to all know another word which is called as the res ipsa loquitur. So, what is this? Fact speaks for itself. Okay, facts speaks for itself. Okay, now what is this res ipsa loquitur? Why are we worried about res ipsa loquitur? Is generally, whenever there is a negligence, the patient has to prove negligence. But when you have res ipsa loquitur, like wrong limb surgery, wrong side operation, wrong operation itself, those are all like fact speaks for itself. Leaving an instrument inside, the patient does not have to prove anything. He just goes and says that this is negligence. That's all, right? So this is res ipsa loquitur. Okay, what type of hymen it is? It is, see, whenever in these kinds of images, now when you have a doubt, oh my God, I don't know the types of hymen and everything, just see, draw what you're seeing. You're seeing something like this, right? So what are you seeing in between? You're seeing a septum in between. So it's a septate. Fimbriated means it's going to be like this. This is going to be fimbriated. Annular means it's going to be circular. Semilunar means it's going to be like this. See? Some questions are very easy. You don't have to think about it at all. Okay, let's see the next question. So this is what I told you. Here it has, behavioral change and all complaints will be there. But hair loss is an additional symptom that they present with. Hair loss is an additional symptom that they present with. Think about your thallium. Think about your thallium. Okay, next. Antidote for opioid poisoning. Very easily answerable. Naloxone. And here they have given iron tablet. Okay, iron tablet. Desferoxil. Okay, desferoxil. All right. Then consent. Again, you tell all the risk, benefit, complication and everything. That's an informed consent. Implied consent means patient has come with abdominal pain. You tell him go and lie down in the bed. I'll come and examine. You have not told him that you're going to examine the abdomen or anything. You just told him you just go and lie in the bed, which means it is implied that you're going to examine the abdomen, right? That is implied consent. Opt out means the patient has, you presume that the patient has not given consent. Okay, so that's opt out. Okay, that's an opt out system. Passive consent, there is nothing as passive consent. They have given it as passive means it's almost like an implied consent. You have not asked anything, you have not said anything, it's just agreed upon. He has come, you have agreed. It's like an implied consent. Okay. Yes. Again, antidote question. Patient present, irritable, passes urine, passes stool, the skin is dry and hot. You're talking about Datura. See, again in 2021 and in 2023, they repeated almost the same question. So that's why we always insist on do the last 10-year question, do the last 10-year question. Okay. All right. Next one. A college student, intravenous drug abuser. Okay. So they have given the word intravenous drug abuser. All of the following is seen except. Okay. So even if you don't go in for a specific diagnosis, think about what all will go together. They have given myocardial ischemia that could be present because of hypertension, vascular spasms, right? That is going. Hyperthermia they have given, and there is agitation they have given. Now, all of these we are talking about is cocaine, right? There's going to be tachycardia over here instead of bradycardia. So it's not consistent with it. It's not consistent with it. So just again a quick revision. Cannabis, run amok, hyperemesis, amotivational syndrome. Patient doesn't want to do anything. All of these are seen in chronic. Okay. In acute, he might have hallucination and all, but chronic is what predominantly they ask. Datura, we have seen stupefying agent. He might also have lint picking behavior. Like in Parkinson's, a pill rolling behavior, lint picking behavior are all seen in Datura. Then you have cocaine. Cocaine produces hypertension. Cocaine dance. That is your this movement, right? And of this movement. Choreothetic movement. That is cocaine dance, right? Crack dance, crack lung, crack eyes, where he gets scars in his eyes. So what happens in cocaine? The patient just burns, he takes cocaine in a small spoon, he burns it from down and he chases the dragon, right? He smoothes like this. Now it is called as crack because your cocaine is mixed with sodium bicarbonate and it produces a crackling sound, right? And when you get that crackling sound, the patient is inhaling, he is going to get burns in his nose region, his eyebrows and eyelashes will fall off, he can get burned in his cornea. Because of the hypertension and along with the ischemia that's going on, he can get nasal perforations and of course he gets cocaine burns, right? It's a tactile hallucination. Okay. Then you have LSD. LSD, he has a flashback. Flashback means not he remembers what everything is, but he remembers the effect of drug in withdrawal. So he is in withdrawal, but he will remember the effect of the drug. Okay. Yes. This is what type of injury it is. It's in the scalp region. Now, again, this injury might look very bloody, but in your exams, they give you a very clean injury, right? Okay. It is over the bony prominences. Okay. So either we are looking like at an incision or at a laceration. First, rule out all that doesn't work with it. Okay. A lacerated looking incised wound. Incised, it's an incision. It cannot be produced by a blunt force. Okay. Similarly, incised looking laceration. A laceration cannot be produced by sharp force. Right. So among these two only you have. Now I'm able to see the tissue bridges over here. Again, in your exams, they will give you much clearer image. Don't worry about it. So it's an incised looking laceration. Okay. So thanatology, some points for you to go through. We have put in over here. Revise through these points. Okay. So when you see your abrasion, remember the mnemonics PIGS. Okay. Pressure abrasion. Your pressure abrasion. Classical example is ligature mark. They have asked it in previous exams. Imprint abrasions. These imprint and pressure act perpendicularly. They can produce a pattern of the wound, right? Then you have your grazed abrasion. The skin has got grazed, and then you have scratch abrasion, right? In grazed abrasion, you get skin tags. Similarly, go for your contusions, black eye, battle sign, all of these. Just revise through it so that you know what it is. And last, laceration. We have seen incised looking lacerations. They are seen over bony prominences. Okay. Whereas your lacerated looking incised wounds, these are seen over wrinkles. Like in neck. Okay. Or in your scrotum. Yes. So with this, you identify it. Now, how will I identify is one is tissue bridges, and also remember there is no, again, you will get a clearer image. So don't worry about this particular injury. Okay, let's look into the next part. Sunny day. Can you see the resemblance between 2021 questions and the 2023 questions? How close they have been, right? Yes, which of the following is not likely present? Profuse sweating is not likely present. So revise through your 2022 question, please. All right. A 35-year-old male, known behavior of showing his, being nude in naked in his balcony and everything. It's a classical case of exhibition. Now, this tabulation again, revise through this tabulation because a similar question, eonism has been, with eonism, match the following has come in any set. When things come in any set, there's a probability of it, right? Sadism is inflicting pain. Masochism is themselves getting pain. Allognia is a combination. It's a combination. Fetichism, voyeurism. Students get confused. See, fortune, FR. R is rubbing. Okay. Fetish is inanimate objects. Fetish is inanimate object. Okay. Fetish is inanimate objects, which means he uses a rock, he uses a brazier or something to get sexual gratifications. Okay. All of these they use to get sexual gratification. Voyeurism is peeping Tom, exhibition is being naked. Transvestism, the word that they are using is yawnism, particularly the undergarment we are talking about. When you tell undinism, urolgnia, all of these are related to urine. Okay. And corpalglia is feces, corpo, feces. Triolism means involving three people, sexual activity involving three people. This also they have asked previously, satiricism and nymphomania. Satai means sexual drive in male. Okay, nympho means female. Nympho means female. Satai means male. Okay, nympho means female. Okay, then pregnant woman delivers a twin of similar gestational age. Paternity testing of the child reveals different father. Which of the following is most likely? Explain. Okay. They have given similar developmental age, which means the same cycle, different intercourse. Okay, same cycle, different intercourse. Okay, now here there is a fetus on top another fetus. Okay. Fecal tissue ab extra. So again, these are important points. So we will go through them quickly. Fecal tissue ab extra means the semen is deposited out, but still the female gets pregnant. Okay. Here, pseudo, spurious, phantom pregnancy means fake pregnancy. Okay. Superfetation means different cycle. So there's already a fetus. She's pregnant, but in the next cycle, again, she ovulates and on top of it, she gets a baby, right? So here you're going to have baby of different age. So twin of different age. Superfecundation means here you have twin of same age. Fetation, fetus, right? There's a fetus on top of it, another fetus. This is due to vanishing twin is like, blood insufficiency in one child. Legitimate means within 280 days of being with the father if a child is born. Okay, wife being with her husband within 280 days, the child is born means it's a legitimate child. Posthumous child means after birth, death of father. Supposititious child means it's not her own child, so it's a fake child she brings for inheritance or some other purpose. Atavism means a child resembling grandparents. Okay, again, a fake abortion clinic means they are not doing abortion, but they are religious places which tell that they are abortion clinic, but convinces the mother for not abortion. The female goes out and get illegal abortion and other things, right? Vegitis utrinus. Utrinus means cry of child in uterus. Vaginalis means cry of child in vagina. Okay. Munchausen syndrome means they come repeatedly to the hospital with some symptoms. Munchausen syndrome by proxy means they bring a proxy. That can be a child, a grandparent to the hospital, saying that this child is sick, the grandparent is sick, this, that, this, that. Shaken baby syndrome, the baby is shaken like, vigorously. Now, this shaken baby syndrome produces three things. One is diffuse axonal injury, okay, acceleration, deceleration trauma, subdural hemorrhage, and retinal injuries. Okay, so instead of diffuse axonal injury, they can also mention just as edema in the brain is seen. In battered baby syndrome, there is a delay in coming to hospital. There is a history which is not correlating. And the last one, they have injury of different age. Injury of different age. Okay. Okay. Then image. What is this? This is a case of marbling. Now we often confuse marbling with this. Well, can you tell me what is this image? This, what the one that I put as one, what is this? Can you tell? The upper one is marbling. Yes, this is filigree burns. This is filigree burns. Okay. Now, can you tell us what this image is? Can you tell us what this image is? What is this image showing? Washerwoman's hands. Very good. Drowning. Yeah, this is drowning. This is washerwoman's hand. Very good. So this is drowning. Features of drowning. Just revise through it again. Okay, so washerwoman hand is seen in 10 to 12 hours. Do revise through the. It is seen both in antemortem and postmortem. It just indicates immersion. Immersion. It just indicates immersion, which means you cannot see looking at it whether it's antemortem or postmortem. Okay, it's just indicating immersion. Okay, let's look into what is phalanga. Can you tell us what is phalanga? Because the word is there, I'm asking you. Yes, in torture, it's a torture by hitting the soul. Yeah, soul beam. Very good. Very good. Okay. Yes or no type of question is known as leading questions. Okay. It is seen in cross-examination. Okay. Leading question can be seen in cross-examination. It can be also asked by the judge anytime. And it's mainly asked in cross-examination by the opposite party. Okay. Okay. Active principle. What is this poison first? Identify the plant. What is this? Can you identify this plant? Yes, semicarpus. Okay, so semicarpus anacardium. See, Abrus precatorius is Pilayar Kannam, the one with red and small. Yeah, this is semicarpus anacardium or marking nut. Active principle. I told you guys this when I was teaching that they will never ask for Abrus and all because that's very easy. Nabrin, Abrinin, and everything. Yes, this is bilavanol. Okay. It is semicarpal bilavanol. Semicarpal bilavanol. Abrine is seen in your Abrus precatorius. Atropine is seen in Datura, right? Datura. And Strychnus is in Strychnus nux vomica. Okay, so they don't ask all those things. Okay, 2020, I'm going to let you guys to revise on your own because I know you would be having your own plan for reading also. But before we close, let's just look into the pictures once. Try to identify the picture. I want you to know the differences particularly. I'll share this document, revise through it once. See, when we say resinous, look at the knob. Shiny, dull will not help you in identifying the exam. Yes, the knob. Okay. See, when you see images in your exams, don't panic. If they ask you completely new images, it's absolutely new thing that you're seeing for the first time. Rule out the ones that you have seen so that you can give the answer. Rule out the ones that you have already seen so that you can give the answer. Okay, so this is Ricinus communis. This is Croton tickler, right? It is dull, no knob. This is Abrus precatorius. Look at it. It's like this small round with, it can be in red black or brown black also. One crushed seed is poisonous. And in this plant is also called as the Pilayar Kannu. This is the one that's used to produce sui. And the needle produced from sonola, like when we studied that you take DOG. Datura, okay, opium or onion, and you take glass along with it, that is your Abrus precatorius. You crush it, yes, you make a needle out of it and take 2 needles, hit a cattle or any other animal, it mimics a viper bite. Okay, then you have Calotropus, Semicarpus anacardium, marking nut, right? What is the medico-legal importance of marking nut? What is the medico-legal importance of this marking nut? Medico-legal importance of marking nut? Very good. Artificial bruise. Okay. So the same goes for your Calotropus also. Okay, but apart from your artificial bruise, Calotropus can be used for infanticide. This is Capsicum annum. It looks similar to Datura, but the color is generally very light, right? Though I say don't use color as a picture, here you can use color. And another thing is when we say Datura, we are talking about more of a, kidney-like shaped. Like this it will be, not complete round. Here they are like more of round chili seeds. Okay. This is Strichinus nux vomica. It's more like a berry, orange, chinna orange or a small orange berry. And the seeds are RBC shaped. So if you take the seeds, it looks like almost like a RBC. Can you see this? Like it's bicon cave shape. Okay, now among these, except for Strichinus, all of the first few are irritants. Your Strichinus nux vomica is a spinal. That too in the anterior cell. Okay. Here we have our cardiac poisons. Again, so that's why I see like a palakira madri. The leaves are pretty big. Okay, and you have a flower like this means think about nicotina tobacco. Okay. Cerebrathibacia, all highways in Tamil Nadu are nowadays having this. Many of even your own institutions, colleges, many places for a decorative purpose, even in houses, they grow this yellow color, nice plant, yellow oleander. This is also called as the yellow oleander. Cerbera odorum, this is like a mango-like. Right? Cnidium odorum, this is the pink and the white oleanders. Okay, pink and the white oleanders. Right? Mango-like, mango, odolum. Okay, odolum. All right. Then you have aconite. Aconite, classical features they will give us hippus, alternate contraction and relaxation of the pupil, monkhood, right? Even 1 gram of its root is poisoning. The root mimics a horseradish. Okay. All right. This is opium. Opium is, yes, perioral anesthesia. Yes. Opium is taken from unripened fruit. Okay, from the unripe fruit, you take opium because you need to take the milk out of it. Okay, so this is how opium looks. The seeds of opium is cuscus. It's non-poisonous. Okay, cuscus. Manal madri, if they give you something like a sand, Yes, that we are talking about is Papaverus somniferus. Yes, opium is Papaverus somniferus. Very good. Okay, then this is cannabis. Again, look at the leaf of cannabis. Look at the leaf of cannabis so that you can identify it. Okay, now cannabis, if it's only the leaf we are talking about, it's bhang. The female flowering top flower is the one that is called as ganja. Okay, you call it as ganja, marijuana, right? Then the resin is called as charas, and the oil that is used to extract is the hashish oil. The oil that is used to extract is the hashish oil. Okay, LSD and ergot grows out. Okay, it's an ergot that goes out. Then finally you have a magic mushroom. Again, magic mushroom, they have not given image, but they have asked which mushroom. Psilocybin. Okay, psilocybin is the mushroom that is used in it. All right, last part, snakes. See, black color snake. Cobra, you won't have problem. Black color snake, if you are seeing, and in the snake, like if you have white color stripe, think about common trait. Okay, but also remember the front part of it. Okay, the front part of it is white. So the back is black with stripe. The front part of it is white. Now these both are neuro, these both are vascular. Or both your vipers are vasculotoxic. Okay. When we say Russell's viper la pathina, see, both will look like almost like a diamond is only present. Both of them will maintain almost like a diamond only present. In the Russell's viper, the diamond is well defined. One diamond, it will leave and then the next diamond will become start. Okay, that is how I remember Russell's viper. Whereas in saw-scaled viper, it is actually not diamond it is having. On either side, it will have a saw scale like pattern. Now, this when it combines together, it will look like a diamond. But it's actually a saw-scaled pattern that they have. But when you see a diamond, well-defined diamond on the surface, you think about Russell's viper. Okay. Now, last one, myotoxic will be your sea snake. For sea snake, we do not have anti-snake venom in India. All right. Now, this is the IPC to BNS. Again, BNS is coming in July, right? So, you're writing in June. We are not expecting it, but again, the core area first finish it. Then when you get the time, just revise through it. Okay, just revise through it. We have studied 304A. This 104 became a lot of gained a lot of importance. We had death due to rash and negligent act. Now that has been converted. Now this for doctors still it is 2 years only. Okay, this is 2 years only. All right. And another part I wanted to stress on was our grievous hurt. Okay, our hurt and grievous hurt. Yeah, here it is. In grievous hurt, previously we were studying 20 days. In the newer modification, they have brought in 15 days. Okay. So again, it's a new one that's going to come in July only into implementation. So we are not expecting them to ask you section by section like they used to ask previously, but at least know there is something called as the BNS, which was a bill in 2023 and has come to force or is going to come to force in 2024. Know that for doctors, people went on strike and the punishment is still 2 years only. Okay, for rash and negligent act, death due to rash and negligent act. Grievous hurt, they have made it into 15 days. They have made it into 15 days. Rest all, they have predominantly preserved only. The sections have changed across. All right. So we had 511 sections when we were studying IPCs. Now we have only 356. Multiples are clubbed together. So here itself, you can see previously we used to have 321, 323 and all. 113, they have made it all uniform. Try to do your core areas. first. Okay, try to do your core areas first. Okay, now let me take you some questions. Again, continue reading. Reading is the only core factors. Try to join in for the morning 4:30 study with me sessions. Try to join in for your evening sessions. Next, hardly you have another 18 days. Focus, focus, focus. Focus is the key. So let me just take few questions before we close the session. Ma'am, please tell me few points about LSD. Okay, LSD causes main classical symptoms that they give with LSD is the flashback. Okay, so what do we mean by flashback means? Or a bad trip means the patient is in withdrawal. He doesn't want to take the drug again. Okay, these are all drugs which cause a psychological dependence. So here the patient doesn't want to take the drug, but he will have the feeling of the effect of drug on him. Okay, so that's the feature that's seen with LSD. Okay, the bad trip is the most important point. Another one of you asked, ma'am, you can see in the picture. Okay, I can do that. I will share it in the group, and along with it, I will also share one more document. And that document is about year-wise analysis. Please do go through that also. If you don't have time to see this whole document, please do go through the year-wise analysis if possible. I'll show that. Okay, so this is the document. Just go through it in once so that you would be able to, get an idea as to what it is. So this also will be there. Ma'am, how much time and importance to give for thanatology and identification? Okay, it depends on how much you have read thanatology and identification. In 2020, so here it is, yes. See, so thanatology, they do ask questions. Year after year, they have asked one or the other forms of questions from thanatology. So I would I will not, suggest you to skip thanatology. Identification, do read dactylography, do look into the x-rays. Okay, do read dactylography, do look into the x-rays. But ideally, yes, try to get a much of revision as to what is identification. Ma'am, silly down, since there is a lot of similar questions in 2020. Yeah, similarity. That's what I'm also expecting. Fingers crossed. There is a lot of similarity between 2021 and 2023. 2022 and 2024 comes means well and good. Yes, please do revise through the previous ones also. Ma'am, can you explain ballistic? I'm confused as to the shotgun and yeah, I can do that. I can do that. I can explain that. Firearm. Okay, see, when we are saying shotguns, you are talking about pellets, right? Small pellets we are talking about. Now, what happens is this. You have a gun over here. Okay, now you have fired the gun. The first thing that comes out is the fire along with the bullet and everything. Then your bullet keeps on traveling. Your bullet will come till here, right? But your fire has stopped over here. So here you have a range which is within the range of fire, right? Very close contact, right? Here you have within fire. So we call it as the loose contact or something. Okay. And then you have smoke. Where there is a fire, there is a smoke. So smoke comes till here. Now, fire will produce burn, whereas your smoke will produce blackening. Right? So you have a range till where you get blackening also. Now, along with this, what is also coming? Your unburnt. See, these gunpowders are very small, but still, even a sand has some mass. So when they have a mass, they are going to travel, right? Some velocity. Now, this gunpowder which travels, right? The gunpowder which travels is going to produce your tattooing. Now, this is the tattooing that you're seeing over here. Okay. Yes. Ranges in ballistic. Okay. So what I suggest is this. They give you close contact, long distance, intermediate distance. When we talk about long, we are getting only your bullet injury. Long means we are predominantly getting only your bullet injury. Intermediate means you're getting your tattooing. Okay. Whereas when we are seeing your closed range, you get your smoke. In closed range, you are getting your smoke injury. Okay. So here we are seeing blackening. So we are telling it as a close. Contact means, okay, now contact means what happens is there's a soft contact where you get fire, and there's a hard contact. When there's a hard contact, the gas expands below the skin. So what happens? The injury is more of stellate shape like this. Injury is more of stellate shape like this. Okay. Yes. And one of you asked about agricultural poison. Okay, in agricultural poisons, know about your aluminum phosphide. Okay, know about aluminum phosphide. Aluminum phosphide is a rodenticide. That's the most important one that you have to know about. Phosphine in that is the one that causes all the clinical features. One tablet, it's available in a tablet form, not in a powdered form. One tablet is sufficient to kill a person. But another thing that last year they have asked about is your yes. In the last any set, what they have asked about is your barium, right? So whenever in the question you are seeing there is a deranged level of potassium, whenever in the question you are seeing a deranged level of potassium, think about barium. Okay, think about barium. So in the last time, what they gave is they gave a severe hypokalemia. So severe hypokalemia is seen with barium, and it typically occurs within 2 hours when the person has taken it orally. Okay. This hypokalemia gets exaggerated when the patient is having a blood transfusion. So this is one thing that you should be going about. So that was the previous year question that they have asked. All right. So with that, we will finish the session. It's 7:30. Have a great day. Keep reading, keep reading. Whether you're in a mood, not in a mood, continue to read. Okay. All the best. Thank you. Thank you all.